and welcome to the Dr. Janine Show. I'm so happy to have you all here today. As you're streaming in, please say hello and where you're from. We have so many fantastic topics, something that all of my viewers have been requesting for. So talking about, we talked about the ladies last week with balancing hormones, but guys, this week we're talking about andropause. So this is something that I definitely want you to stay tuned for, as well as vitamin K2 and why this is so important for our cardiovascular health. We're also talking about our thyroid health today, focusing in on low thyroid, so hypothyroidism, and something called Pregnenolone steal syndrome. So we will be reviewing that as well. And we will be coming back into the beauty set, and we're going to be doing some microneedling with the device today. It's a little bit more aggressive than the roller that I showed you last week. So stay tuned for that. It's a jam-packed show. Remember, this show is super interactive as well. So of course, we're going to be having quiz questions throughout the show, and that's something that definitely we want to make sure that you are paying attention to all the content throughout the show, okay? So for this week, we're going to be playing for the thyroid support from our great sponsors at Vitatree Nutritionals. Okay, is everybody ready to get started? Hello, and it's great to have you here. Blue Every in France, nice to have you here, and Dawn M. Cool in Michigan, thank you for tuning in. Elaine is here from Calgary. Hello. Judy in South Africa, great to have you here. And Manoj in India, great to have you here. Tisha in Louisiana, hello, thank you for tuning in today. It's great to have you all here. Okay, Kathy, good morning, nice to see you. And Kevin in Columbus, Ohio. Virgo Chick in Indiana, thank you for tuning in. And Angela in Texas. Angie, thank you for tuning in this morning. Okay, is everybody ready to get started? All right, so let's first start talking a little bit about Pregnenolone steal syndrome. Now, if you have missed this, we're also going to be talking about vitamin K2, so that's coming up, and of course low thyroid, so that's coming up as well, so stay tuned for that. I know a lot of people have questions about low thyroid, what we can do. I want you to pay attention. Pregnenolone steal syndrome is related to your thyroid health, okay? So if you do have an underperforming thyroid, and we're going to go through some of those symptoms of low thyroid, that's coming up as well. With Pregnenolone steal syndrome, I'm going to show you how this can be affecting your thyroid. So when we're taking a look at pregnenolone, which of course is derived from our cholesterol, now pregnenolone preferentially, when you've got leptin resistance, which of course something that I've talked a lot about in my content, which a lot of people don't know a lot about, so I want you to learn about that leptin resistance. You can check out my other content all about leptin resistance, but pregnenolone is a hormone that's going to make our downstream hormones. So this becomes important for andropause. So yes, guys, we're going to be talking about andropause. It's like the male version of menopause, which happens as you're aging. As much as you don't want to admit it, it's partially going to be happening to everybody, depending on how well you manage it or not, guys. And we're going to go through some of the most common symptoms of andropause coming up as well. But here you can see, okay, so DHEA is going to help to make our downstream hormones like testosterone, important for women, but also for the guys, estrogen. And here we see progesterone. Now, what happens in times of stress, when our stress levels go through the roof, when we're not balancing our hormones, when we're not optimizing our light cycles of the day, when we're not seeing the sunrise, a lot of things that I talk about, what happens is that preferentially, and we've got that leptin resistance, we're making more cortisol, more of that stress hormone. And we've got enough stress to begin with, but now our body's going to be making more of that cortisol. That is the Pregnenolone steal syndrome. It's going to affect our blood pressure as well. This is not a great thing. Now, it does affect our thyroid hormone as well, okay? So that conversion from T4 to T3 is now compromised, and we increase something called reverse T3, which is going to shut down the thyroid. It's going to shut down this conversion T4 to T3, and this all stems from that leptin signaling, that leptin resistance. So this becomes really important when we're talking about really optimizing, of course, the health of our thyroid, getting our metabolism going. This is something that is really important. Now, I'm going to talk about low thyroid symptoms now. Let's go through them, because a lot of you have those low thyroid symptoms, and actually we're going to come back to that. Let's talk first about vitamin K2, because this is really important, and a lot of you have asked about vitamin K2. Now, vitamin K2, there's different types, but it's like the major air traffic controller in our body for calcium. So imagine in a busy airport, okay, what's happening. I can just imagine in parts of the US right now with the big hurricane coming, the second one, I mean, in the last couple of weeks, I mean, it's crazy. And we all pray for Florida and other parts of the US right now with that hurricane. But here's the thing. with a busy airport, that air traffic controller telling where everybody needs to go, the pilots, and everybody on the ground crew, everybody needs to know where to go, or else there would be chaos in the airport, okay? The same is true for vitamin K2, and a lot of people have a vitamin K2 deficiency, you don't even know it. That vitamin K2 is like that air traffic controller, and what it's doing is it is helping to direct calcium where to go. So of course, calcium, we don't want it to be sitting in our arteries because that is a big problem in terms of plaque formation. As you can see on the screen behind me, and you see this video, that plaque formation, that's problematic, okay? The same as in my model here of the artery, we don't want that calcium sitting in these areas. It could also go into the kidneys. Have you heard of kidney stones? Yeah, so kidney stones, let me take Lucy apart really quickly. And here we go, those kidneys, we have to keep our kidneys healthy. It can also go, that calcium can go into and deposit in the liver as well. It can also, of course, form kidney stones, and the kidneys are hidden, tucked way back here. So we don't want that calcium necessarily going into and forming deposits in the kidneys. Of course, vitamin K2 is going to help to regulate. It's going to help to make sure that calcium, one of the big places we want it to go, of course, is into the bones, right? For strong bones, for osteoporosis prevention. We're going to go through some of the research as well as into the teeth. So for strong teeth, we need that vitamin K2, and a lot of people have a vitamin K2, children as well, a K2 deficiency, and that's one of the reasons why their dental health is not optimized, all right? And that's true for adults as well. Now let's talk a little bit about some of the research on vitamin K2. And ladies, I've got some, okay, it's Mr. Fat. We're gonna be talking about fat and fat loss, and that's important for the guys as well, of course, but vitamin K2. And in this study, it was found that participants in the study who had a vitamin K2 status that was optimized had a 57% lower risk of dying from heart disease. And that was really important. Okay, that was the first study. Okay, here we go. All right. Now, that was called the Rotterdam study. Now, in another study, ladies, this was done on postmenopausal women. I'm going to sneak over here and grab Mr. Fat really quickly. This is important. MK7, so the type of vitamin K2 that I usually prefer, that's the one that I take personally, and I'll tell you a little bit about the one that I take in just a second. But they found in this study in postmenopausal women reduced belly fat. Hello, yes, perimenopause, menopause, that belly fat is something that we talked about last week with menopause. But MK7, which is the form of vitamin K2 that I prefer, treatment resulted in a significant increase in molecular weight, adiponectin, and decrease in, what does that say? Abdominal fat mass. Hello, even the visceral fat around and in the organs was decreased as well by optimizing vitamin K2 levels. So that is super, super promising, especially if you're trying and you're struggling to get that belly fat off, that menopausal weight. Absolutely important with your vitamin K2. It's also known to be great for beauty. So this is one of the reasons why in Japan, it is also used to prevent and treat osteoporosis, and especially in postmenopausal women, that vitamin K2, but in their diet, they consume fermented soybeans, and this is called natto, and that's one of the reasons that it's believed that Japanese women just have porcelain, beautiful skin without any wrinkles, is because of their vitamin K2 intake. So isn't that interesting? All right, thank you for everybody tuning in today. Please say hello where you're from. If you're here for the first time, please put a 1 in the comments. Be sure that you're sharing today's live as well. Thank you for all the hearts coming in. I see that. Thank you. Continue to tap your screen or do whatever you need to do. I love seeing all those hearts flow through during the live. It makes me happy. We all love hearts, don't we? Okay, guess what time it is. So everybody, if you're here for the first time, Barbara, thank you for tuning in for the first time. A2 Queen, hello, Novrites, and Yulan, Alice Serre, thank you for tuning in. Make sure you hit that subscribe, that follow button. It's great to have you here. Okay, so this is a very interactive show. I know there's a lot of new people here today, and Vanessa as well. This is what we do. So we have quiz questions throughout the show, and that's why it's a little bit important to stay tuned for the entire show and listen, to the content that I'm sharing. And today we're playing for a prize, so you can win this. It'll be shipped free to you. And this is our thyroid support from our great friends, our sponsor of the show, of course, Vitatree Nutritionals, whole food vitamins. Okay, are we ready? Let's go on over here. I hope everybody was paying attention. All right, it's a question that I've actually asked before, but I'm asking it again. So if you're new here, I hope that you've tuned in on time. Remember, we start around 11 a.m. Each Tuesday, so make sure you tune in next week as well. Okay, quiz question number 1, here we go. Which hormone takes priority in Pregnenolone steal syndrome? Something that we opened up the show with. Even if you came in late, just take a guess. Make sure you hit that share button, everyone, as well, please. We're gonna have 30 seconds on the clock. Oh, it's already counting down. Everybody get your answers in. Which one takes priority in Pregnenolone steal syndrome? About 15 seconds left. Let's go. All right. Everybody got your answers in? Oh, yes, I see some. Whitehill is here. Ulan, 1964. Thank you for tuning in. Buki Bello, thank you so much. Okay, some people are struggling a little bit. Oh my goodness. I hope we're going to make a correction here. All right, everybody. Doing Raina, you know that I'm talking to you, right? It's okay. It's good. Raina never gets anything wrong. But I think we've stumped you this time. Okay, Eva, yes. Okay, yes. Let's reveal. Everybody got your answers in. Of course, cortisol. So cortisol takes the cake, all right, when we're talking about Pregnenolone steal syndrome. So your body keeps making more cortisol, and you're wondering why you can't. That's one of the reasons why, of course, you can't target that belly fat when you've got that Pregnenolone steal and that leptin resistance. A lot of inflammation in your body is something that we're going to circle back to. All right. So I do want to congratulate last week's winner, okay, of the Vitatree Magnesium, and it was here. Who was it? It was the winner was all right. All right, here it comes. I know I'm keeping you in suspense today. Thank you, everybody, for hitting that share button, and hey, Hayat, thank you for the follow. Great to have you here. Thank you, and participating again in our first quiz question. All right, we have a few more quiz questions coming up. Sky Tenchi 8, thank you so much for participating. You are the winner of the Vitatree Magnesium. So continue to play. Make sure you are following Team Dr. Janine so that my team can, of course, reach out to you if you are our winner. And of course, we will announce this week's winner in next week's show. So you have to tune in. All right, now let's continue about vitamin K2. All right, now we're going to have a little bit of a game today with a fill in the blanks, and that is coming up in just a few moments, but let's continue on the conversation with vitamin K2. Okay, so we know that there's something called osteocalcin, and this is activated by our vitamin K2. This becomes very important. It acts like a hormone and reduces both our insulin sensitivity. So it has an activity with our pancreas, of course, for insulin sensitivity and regulating our blood glucose levels, that osteocalcin. Remember, this is regulated by our vitamin K2. Now, the problem with this osteocalcin, and if you've got leptin resistance, is that leptin actually destroys your osteocalcin, all right? So you can imagine now, you're not going to have proper insulin synthesis, so your blood glucose levels will not be regulated. This is why I always say that the leptin resistance happens before you get the insulin resistance. Does this all make sense now? For those of you who have been with me for a while, you understand these connections that we're making, okay? So osteocalcin, vitamin K2, very, very important. As well as we talked about the adiponectin, of course, decreasing our fat mass. So osteocalcin helps with that fat loss. That's one of the reasons why that study in postmenopausal women showed that it helped, especially with belly fat, when the hormones are changing, because of the fact that K2 stimulates your osteocalcin, okay? Also your insulin sensitivity in the muscles, your brain, and your neurotransmitters. This is why one of the reasons with leptin resistance, the hormones changing as well, is that we're going to talk about this with the guys with your memory and what can happen with andropause and leptin issues happening here. And of course, your testosterone could be depleted. That goes to show you for andropause guys as well, which we will talk about. Okay, so this vitamin K2 is super important. And it also helps with your dental health, so stimulates the growth of the dentin for strong teeth. And also we know that, for Japanese women, something that we mentioned, that in their diet for their beautiful skin, this is one of the things that tend to get a little bit more of that natural K2 in their diet because of eating the fermented soybeans. Now, most forms of vitamin K2, because I know you're all wondering which is the best one to take, most of them are naturally made by the bacteria in the human gut. And the type as a supplement that I prefer is actually called the MK7, so menaquinone, all right? And that has superior absorption when they've done studies. So MK7 better than the MK4s and the other MKs. Now, this is something that please, and this is the one that I actually take, it tastes delicious, it's chewable, it's in a fat-soluble format, so that becomes very important. Everybody hit that share button for me, please. Thank you for all the likes, and thank you, Raina, for sharing. I think you shared like 5-10 times right now. Thank you so much. I appreciate that. And all those hearts coming in as well. Amazing. Thank you for making this show fun for me. As I see all those hearts coming in, thank you, and tapping the screen or liking or whatever you need to do. All right. Thank you. All right. Now, the recommended daily dosage for adults is around 110 micrograms a day. For kids, and this is what I do recommend for children aged 4 and up, is around 55 micrograms per day. And it's something that you want to take at bedtime. And remember, in those MCTs, because it is fat soluble, those MCTs from coconuts help with the proper absorption of that MK7 vitamin K2. So that's what you can be looking for. All right. Awesome. I do want to say a shout out to my viewer spotlight of the week. And this is from Francis Venezuela. Thank you so much. And you said, I love learning from you. Thank you so much for all the great info you share. Love the fact that you are sharing that positive energy, those positive vibes. Love it. Thank you so much. Okay, now we will be, guys, I promise, we're going to be talking about Andropause. That is coming up in just a few moments. But first, let's do a bit of a game. You know that I love games. It's like a game show here at the Dr. Janine Show. Everybody give me a thumbs up if you love the games and the fill in the blanks and the quiz questions. It's so much fun, right? All right, so we're going to do a bit of a fill in the blanks. And circling back to the thyroid. So where's the thyroid? Really quickly. So we're talking, remember, about, and with a focus now on fixing low thyroid. So of course the thyroid can become enlarged in both hyper but hypothyroidism as well. And it's called a goiter. And we're going to now fill in the blanks, keeping low thyroid in mind. All right, are we ready? Everybody's ready? Yes, I see all those hearts coming in. Thank you so much for sharing. Sue B, 745, thank you so much for sharing the live today. It's great to have you here. I know, I see a lot of thumbs up. Buki, Bello, thank you so much. Bernadette, Casperson, thank you so much for tuning in. All right, are we ready to fill in the blanks? Okay, so when we're talking about, this is about low thyroid. I don't know if I should probably fill this in. So tips for low thyroid. All right. Is everybody ready? Do you know what the first one is? Here we go. Number one, what are we doing? We are going to fix blank resistance. What are we fixing? Something that we just talked about with Pregnenolone steel. M. Calabro 66 is the first answer that I saw that was correct. Kathy, of course, has it as well. Good job. Lucia, Julie, yes. Safrina, good job. Okay, I see a lot of good answers coming in. All right, perfect. All right, so fix your leptin with a P resistance first, all right? When we're fixing our low thyroid. That becomes very, very important. Okay, number two, don't eat after, and this is related back to your leptin levels. We do not, especially if you've got a thyroid issue, your thyroid hormone is most active when you're sleeping at nighttime. So if your circadian biology, your circadian rhythms are off and they're not optimized, you won't properly secrete your proper thyroid hormones. And that goes for hyper, but also hypothyroidism. So you don't eat after. Yes, of course, the answer is dark. Don't eat after dark. Oh, that's really messy, but there we go. All right, number three, exercise should be, all right, so what have I said? This one's a little bit tricky, I know, because you have to try to get inside my mind, and that could be a fun thing to do, right? Yeah, so what have I said before about exercise at the beginning when you're fixing your leptin signaling? Is it something that we want to do a lot of, maybe not? Yes, okay, I see, yes, good answers, everyone. Exercise should be, oh, and I like that answer, is very good as well. SG, I like that answer. Yes, yes, Safrina, that's what I was looking for specifically. Moderate. You don't want to overdo it at the beginning when you're fixing your low thyroid / leptin resistance, okay? Oftentimes it's not even a low thyroid, it's a leptin resistance issue, and it's sort of translating into that reverse T3 secretion, which is shutting down your conversion of your T4 to your T3. So it's not technically a thyroid problem, it's a leptin problem, but this is why it becomes so important. Okay, so exercise should be moderate and consistent. I like that answer as well, SG. Really great answer. Okay, let's go to number 4, and please say hello, everyone, and please share today's live as well. I appreciate all the love coming in. Hit that like button, tap your screen, whatever it takes. I love to see those hearts flowing through. Okay, let's continue. Wake up with the, what's the answer here? Raina, yes. Love that. Okay, M. Baines, Lisa, good job. White Mazda is in the house and has the right answer. Carol, good job. Julie, nice. Kathy, of course. Music Addict, of course. I love when you put the emojis in. Love that, love that. Okay, so wake up with the sun. So you want to see that sunrise, of course, right? This is what's going to set up your hormones properly and your leptin signaling for the entire day, right? And that translates into weeks, into months, and then you're getting better, you're getting better, you're getting better. All right, number 5, get enough blank in your diet. Okay, remember we're talking about low thyroid. What would be something important to get in the diet when we're talking about thyroid? And there's a lot of right answers here. I'm looking specifically, I'll narrow it down if I don't see it coming through right away. Oh, Anton, I like that answer. That's actually really good. Something that we already talked about in today's show in terms of nutrients. Yes, M. Baines 13, that's what I was looking for. Iodine. So iodine, maybe I'll just put the chemical signal. Iodine. All right, so iodine becomes very, very important, of course, in terms of feeding your thyroid. It's one of the essential nutrients that your thyroid needs. Okay, number 6, let's continue. Avoid cleaning or contact with something very specific in the house. And it's related to this, something that we've talked about before, okay? So what would that be? Yes, chemicals. I'm looking for a specific chemical. Yes, all right. I see it. It's coming in. I'm so proud of everybody who's here today. Thank you. Awesome. Okay. Yes, everybody is getting their answers in. Thank you for liking today's live as well. And for all my new followers, so please hit that follow button and make sure that you are subscribed for all the new people tuning in today. We do this every week on Tuesdays, of course, at 11 a.m. at the Dr. Janine Show. We have so much fun. All right, it's educational but fun at the same time, right? Okay, cleaning with bleach, chlorine. Okay, so bleach, that's exactly what I was looking for and why. And we'll bring that up maybe next week. We'll talk about the halogens again. So fluoride, something that we talked about in last week or a couple weeks ago in the show, why it's so toxic for your thyroid specifically, but for your breast health as well. It displaces, it's called halogen, displaces all your good stuff, all right? Especially your iodine. So avoid cleaning in contact with bleach, especially if you have low thyroid. Okay, number 7, use blank-free toothpaste. This should be easy. We're talking about the same sort of thing here with the halogens. I think I just mentioned it probably as well. Nath PM, guten Abend. Nice to have you here. Thank you for tuning in today. All right. Yes. All right, good. Yep, I see the right answer coming in on all the platforms. Amazing. So fluoride. So fluoride-free toothpaste, really important for any type of thyroid issue, all right? Both hyper and hypo. Okay, number 8, of course, and for everyone really, even if you don't have a thyroid problem, please switch to fluoride-free toothpaste. That's why we made the recipe of my toothpaste in last week's show, which was amazing. Okay, don't wear blank on the neck. This one's tricky, something that you might put on your skin. What do we not want to put here? Yes, that's the correct answer as well. Yes, I see that answer. It's not what I'm looking for. So what would we put on our skin? We've got it? Yes, Kathy, love it. Sunscreen. Don't wear sunscreen on your neck. Okay, so sunscreen is, of course, controversial. and its use, because you know that I talk a lot about getting natural sunlight exposure, especially if you've got a thyroid issue, you want to expose your neck. All right, to natural sunlight. And we've got a couple more. All right, get more. What? I just said it. What do we want? Get more. What are we getting on our neck? Yes. What are we getting? More. Here we go. Yes. All right. Sunlight. Yes. All right. You've got it. Good job, everyone. More sunlight on the neck, and our final fill in the blank. Now, we do have more quiz questions coming up in the show, so don't think this is it. We're having more fun in today's live. Those questions are coming up, but this was just, a really fun section. Don't hold. What are we not holding near our neck, our thyroid? We've got it already? All right. Yes, of course, the cell phone. Any type of phone, of course, but the cell phone is probably the most compromising. Because of what? Because of the EMFs. It's going to fry your thyroid, it fries your brain. Try to keep it away from you as much as possible. Keep it on airplane mode and do Wi-Fi calling if you absolutely need to call somebody. All right? All right. Good job, everyone. That was so much fun. I know everybody loves doing the fill in blanks, which is amazing. Now we are going to talk about, okay, we're going over here first, but we're going to go back over to the other part of the set here into the beauty section of the show. That's coming up. I'm going to show you how to use the device for microneedling. Amazing for skin regeneration and for your collagen levels. But let's talk about a lot of the symptoms of low thyroid. In case you're wondering, okay, what's all this talk about thyroid? What's happening here? Well, you could have a low thyroid and you don't know it necessarily. And the other thing that's really common is that you're actually being medicated for your low thyroid, yet you still are symptomatic. So if that sounds like you, it's so common, and it's something that I talk to medical doctors about, because there's still this need to help to support what's going on. And remember, the fundamental level here is talking about the leptin signaling, leptin resistance, but also supporting that thyroid is something that we need to do with the right things that we can do with the tools that we have, okay? So fatigue, memory impairment, depression can be related to your thyroid being low. Swollen sensation in the neck area. Not everybody has a swollen thyroid, but it definitely can happen. Swelling of the eye socket, rough, deep, hoarse voice, weight gain, constipation can be related to low thyroid. Rough, dry skin, paresthesia, and muscle cramping can happen as well when your thyroid is low, as well as hair loss. So the hair is falling out, it becomes very dry and brittle. An enlarged thyroid gland, so it may become enlarged. This is not the normal size of a thyroid, okay? This is actually very enlarged, but also slow heart rate and weak heart and diminished potency in terms of sexual desire, libido, and cycles. So women's menstrual cycles can get off, they're not as normal or as regular as what they should be with a low thyroid. And here's one of the things that I did want to chat a little bit about, something that I've never talked about before, is why your conventional thyroid medications simply don't work, okay? A lot of people are medicated, so you've got a lot of those symptoms. Yes, I see that line, with the weight gain and constipation, and this is something that's so common for so many people with low thyroid. And maybe you're even on the medication and it's not helping. So your blood work looks great. The doctor's happy. Oh yeah, your thyroid's great, and according to your blood work. However, it's not maybe so great because you're not feeling well, you're not feeling yourself, and you still have a lot of those symptoms. So some of the big thyroid medications, Synthroid, levothyroxine, they are man-made T4, so your thyroid hormone T4. Now another sort of more natural type is a desiccated thyroid, armor thyroid, and that is coming from pig thyroid, and that is T3 and T4. So there's a bit of an advantage there. If you would have to take any type of medication, I would lean more towards that one. But unfortunately, there are these feedback loops to the brain, and we know that the TSH level goes up when we have low thyroid, so it can get confusing when you've had your blood work done. That higher TSH is now affecting those feedback loops, trying to sort of stimulate the thyroid to work more efficiently and effectively. But at the root cause of a lot of this, of course, is the leptin resistance. And remember, we talked about that Pregnenolone steal. Now with leptin resistance, your leptin signaling has become messed up because of electromagnetism that is man-made in your environment. So those EMFs from blue light, from your circadian biology being messed up. You've got a lot of inflammation. You're eating too late at night. You're craving craving carbs, you're hungry all the time, that is a good indication of your circadian biology is messed up. And you've got the leptin resistance. And this is this ongoing cycle of gaining more weight, and now it's affecting your thyroid because it increases something called reverse T3. And that reverse T3 actually shuts down your proper functioning of your thyroid, your active thyroid hormones, your T3. Okay, so that is something that becomes very important. And how do we fix all of this? Well, this is, fixing our leptin resistance becomes very important. This is one of the reasons now that your thyroid medication isn't necessarily helping you to lose the weight and feel a lot better, get your energy levels back. You still have the dry skin, the constipation, a lot of the things that we talked about, because you didn't address the root cause, right? So that becomes very important. Okay, guess what time it is? It's quiz question number 2. So another quiz question. Remember, this is a very interactive show. Thank you for all those hearts coming in. Thank you for the follow. Zahid, thank you so much. And Pearly Gibb, thanks for the follow. Great to have so many new people here today. Amazing, amazing. Okay, so we're playing for the thyroid support from our great friends at VitaTree Nutritionals, of course, whole food vitamins. And here we go. Are we ready? This one should be fairly simple. It's something that we talked about. Even if you're just tuning in right now, we did earlier talk about this subject. Vitamin K2, let's go. This is a true or false. You got a 50-50 chance, so just try your best. True or false, vitamin K2 prevents heart disease. All right, 30 seconds on the clock. Yes? Okay. I think everybody got their answers in. Thank you for all those hearts coming in. Love that. Amazing. Yes. All right. Let's reveal. Of course, the answer is true. Yes. So that's why vitamin K2 is so important. If you're just tuning in right now, we did talk about how it's very protective, making sure that calcium goes to the right places, not sitting in our arteries, as one example to prevent against heart disease. Also helps if you're just tuning in. Ladies, we talked about postmenopausal women and helping to burn belly fat by optimizing your vitamin K2 levels. So that becomes very important. All right, guys, I know you've been waiting for this now. I promised that I would talk about men and their hormones and what happens. So ladies get menopause, the guys have andropause. And let's go through some of the most common symptoms if you're wondering, okay, is this me? Is this happening to me? Of andropause. All right, so number 1, decreased muscle mass and strength. And it's not like your muscles just fall off your body and you're like, okay, where'd they go? It's more that this is a slow decrease, and it might be harder for you if you do work out and you do some, type of exercise or strength training, that you're noticing that it's more difficult now to maintain that good, muscle strength and ability as you're going through these hormonal changes. Number 2, increased body fat, so it's more difficult to shed off that extra fat, and especially around the midsection, that can be very difficult with andropause. Number 3, of course, decreased bone mineral density. So we always, when we're talking about bone mineral density and osteoporosis prevention, often I find, especially on social media, that there's always a focus on women, but the guys become at risk for this as well. So this becomes very, very important. Thank you for sharing today's live, H, and thank you for following me. Boo. Everybody hit that share button a few times. Please make sure you are subscribed. Hit that follow button as well, so that you're always, up on the newest and latest health information that we share here at the Dr. Janine Show. It's great to have you here. Okay, number 4, of course, is mood changes. So irritability, you fly off the handle very easily. You're depressed. You go from low mood to maybe, and it could be oscillating between feeling low and then being overly, irritated. Again, a sign that those hormones are changing. Number 5 is concentration, memory issues. So difficulty maybe, in memory and completing sentences, like there's just that short-term memory loss is something that you're noticing, and this is hormonal now because of the andropause. As well as number 6, reduced hair growth, and there is some hair loss happening, and this is something that, we have tips for hair loss for everyone, so that's something that we've shared in previous episodes. All right, so I hope you've got that now, guys. Now, let's continue on. And hello. I know, right? Whitehill, exactly. It would be nice if, this was more mainstream knowledge. And I believe Whitehill, one, you're referring to the vitamin K2 and why that's so protective for our cardiovascular health. You would think that we would hear so much more about it, but that's why I share what I do here in the Dr. Janine Show, to really educate you and to empower you over your own health and your healing. Now, we will be going over here in just a second. We're going to be doing that microneedling. I'm actually going to do it on my face with the device, which is amazing, and I'll show you how that works if you're curious, and it's amazing for building up your collagen. But let's first talk a little bit about my tips for Andropause, and some of these will not be a surprise if you've followed me for a while, but we're going to go through this list, and it's something that's really important. All right, so tip number 1, I've got 6 tips for Andropause. Let's go with number 1, which is fix your leptin resistance. Of course, so if you've got the low mood, you've got the irritability, your memory's going, you're gaining the weight, this is something that's so important to fix your leptin resistance. It's usually, at the root cause is why you're not able to access even that body fat. Even if you are working out and you're trying to eat well or cutting your calories, it doesn't work. The whole calories in, calories out has been debunked. It doesn't work when your hormones are at play, okay? So that's true for men and women. So fix your leptin resistance. What does that mean? I've got so many different tips, some of which are gonna be here. Okay, number 2, sleep. You got to sleep, so please prioritize your sleep, because your leptin, your melatonin secretion, your fat burning, your thyroid, everything is active when you're sleeping. If you're not on a regular sleep pattern, and here's the thing with leptin, you're up at night on devices, you're not protecting your eyes, you're up on devices, that's screwing up your testosterone levels, guys. So please, you've got to do something to just change your habits. If your habits are not good, just change them, okay? And that's gonna affect your moods. You're gonna be a healthier and happier person. You might become more successful, and just because your hormones are gonna be in better balance. So prioritize your sleep. If you are on a screen, a device at nighttime, you've got those blue light blocking glasses on. Cover up your skin as well so that you're not blasting your skin with artificial light, especially after the sun has set. Okay, number 3, is follow Mother Nature's prescription. What does that mean? Optimizing your circadian rhythms. That means seeing the sunrise, getting up, going outside, taking off your socks and shoes, and getting on the earth. Okay, you've got to pull up those electrons. You have to connect with the earth to discharge that charge and those protons, that inflammation that you've got in your body. So Mother Nature's prescription, very, very important. Number 4 is optimize your zinc. So zinc helps to lower dihydrotestosterone. That's what's causing your hair to fall out. That's what's causing the fat distribution to change on your body. So we want to be able to manage that dihydrotestosterone, the DHT, so you're optimizing your zinc levels, all right? Everybody hit that share button. Make sure you are subscribed. Thank you for all the love coming in. And please make sure you're sharing today's live. And thank you for tapping your screen and all those hearts coming in. Love it, love it, love it. Okay, so optimize your zinc. What does that mean? Eating more seafood. So oysters are loaded with zinc. Mussels are great. If you're not into seafood, then this might be something that you are considering maybe supplementing with a whole food zinc supplement. Okay, that's another discussion. Okay, number 5, of course, is exercise, and you're focusing in on mobility. So remember, if you're still needing to fix your leptin resistance, you're not killing it in the gym and doing spin classes and like doing crazy stuff. You are doing moderate exercise, focusing in on mobility. I do have a podcast with Erwan Lacour. I want you to check that out. That becomes very important as you're aging to keep that lubrication in the joints. Yoga is fantastic as well. You got to keep that and focus in on mobility training. It's different from doing resistance training. There's a lot of body weight resistance, but it's very different from what you're doing in the gym. I highly recommend that, especially in Andropause. And number 6, is there are specific herbal medicines, and some of my favorites I will be discussing, okay, to help with andropause and balancing those hormones. Very protective for the prostate as well. So let's look at them really quickly. Here we go. Maca is an adaptogenic herb, so helps with testosterone levels, really helps with energy levels, helps with your cortisol levels. Remember with that Pregnenolone steal syndrome, how we started the show, that is applicable here with the leptin resistance and the andropause as well. This is true for the ladies as well in terms of maca. It's in, something that I take in terms of balancing hormones for women, but for the guys, it's a little bit different formulation. Okay, saw palmetto helps with your DHT levels, singing nettle helps with symptoms that could be associated if your prostate prostate is in fact enlarged, then this could be something that you're considering because of the urinary symptoms that could be happening here. Pumpkin seeds also help. They're a natural form of zinc, so a whole food source of zinc helps with lowering the DHT, all right, that dihydrotestosterone. Okay, so you got that. Here we go. Thank you. Okay, Zella was hoping to screenshot, what was it? Okay, we'll go back in just a second. Remember, we'll go back to Zella. She wanted to screenshot maybe the previous one. Can we go really quite quickly to the tips for andropause? Here we go. Zella, was that what you were looking for? I hope so. There we go. All right, now remember everybody to tune in tomorrow. So if you do, I know there's questions coming in, and I can't always get to all the questions throughout the live, so please tune in tomorrow at 1 p.m. Eastern Standard Time for the Q&A, and we'll do a bit of a follow-up to the show. You can ask me your questions at that point if I didn't get to your question today, okay? So tune in tomorrow at 1 p.m. I can't wait to see you there. Thank you so much. Awesome, awesome. I do want to say thank you to all my super fans. You guys are the best. Everybody, all my new followers today as well. So Maggie, thank you for following. It's so great to have so many new people here today. Fantastic. And you know, we're a big welcoming community. We talk all things natural here, and based on a lot of my research, of course. And I do want to say thank you to all my super fans for supporting my channel, for supporting me, and for everything, you know, all the great and wonderful feedback that I get from all of you and your great kind messages. Thank you so much. All right. Are we going over here now? I think we're going over the long-awaited beauty section of the show. Yes? All right, here we go. Microneedling. All right, so this is so much fun. So last week we actually used the roller and this device. So if you missed last week's show, of course it does exist. So the shows remain on some of the platforms and social media. So you can check out last week's show. And I showed you my technique with the roller, the derma microneedling. All right, but today I brought my device. And this one's a little bit, so you can go a little bit more aggressive with this one. So you might want to warm up sort of your skin if you're new to microneedling and use the roller. That's how I did it. I started with the roller, started using that. I like to do it once a month. Now with the device, it penetrates a little bit more deeply, and you can set the device for how deep you want to go. But now you're not manually having to roll over the area. You're just passing over an area with the needles, all right? And there's different depths, of course, as well. So on the device, you can actually set it, and mine is set sort of between the 0.5 and the 0.7, so somewhere around here. So getting actually into the dermis, because it's just penetrating past. So mine's about right here. That's what I've set mine at. Of course, and I started off with my actual roller, as I was sharing last week, at the 0.25 millimeters, and that's the depth, how far the needle is going in, because the whole goal now is to actually penetrate and get into the deeper layers, so beyond the epidermis, so that we're stimulating our collagen growth beneath the skin surface, okay? So that is something that's amazing. Now, with this little device, all you're going to do is you purchase the tips, and the tips are at different how many needles are in each tip. And don't, if you're, I have a huge phobia of needles, so don't let this scare you, because if I can do this, then you can do this if you don't like needles. All right, they're tiny, and this one is 16 needle tip. This one is a 36 needle tip, so that is at your discretion. I'm going to go with the 16 today, and it comes, you know, it's sterile, and it's packed in here. I've already washed my hands, and of course that's really important. Now, if you do have makeup, and I do recommend that you're doing the microneedling at bedtime, because it's going to make you, depending on the sensitivity of your skin, my skin is very sensitive, you're going to see that it becomes very red very quickly, but you're going to do this at bedtime. So you're going to cleanse your face. So that's what I'm going to do first. I'm just going to take off my makeup really quickly as we do this live. Please say hello, everyone. And if you're loving this show, I love all those hearts coming in. Thank you so much. And I do this all in the name of demonstration, and let's say it's science. We'll show you. So I'm going to just take off a bit of my makeup in this area down here. And then what I like to do is use some witch hazel. So you do want to disinfect. You don't want to make sure, because remember, this is penetrating beneath the skin surface, and it's going a little bit more deeply. So you want to make sure that you are actually cleansing that area. So I use a little bit of witch hazel. I've been known to use hydrogen peroxide as well. So a bit of an antiseptic. Witch hazel is great because it's an astringent, so it actually helps to not only cleanse, and here, as much as I thought I got my makeup off, I did not. There we go. I'll go up a little bit higher so you can see. All right, so removing the makeup, and I'm gonna do that one more time with some more witch hazel just to be sure. And it works to help to cleanse the skin. Now, if you use something else that's antiseptic, maybe a tea tree kind of wash as well, you could do that as well. And you're just really cleansing that area so that there is nothing on the skin. All right, I'm gonna let that dry for a second. Now you're gonna attach your tip. I might need scissors, guys. I think they're just over there because it is sealed and, oh no, I got it. All right, so here we go. With your tip, it's going to click into the machine. So you're just gonna click it in. All right, and then it's got a cap, so the cap comes off. And then you won't be able to see it, but there's little needles in there. So I don't know how closely, if it will actually be able to pick it up. It's very difficult to see, but my 16 needles are all in the tip. And when you turn the device on, it actually vibrates the tip and they're sort of going like this, poking up into the skin. All right, so that is how it works. And then there's different settings. So I can set how deeply I want this to penetrate. Like I said, I'm between 0.5 and 0.75. And then there's different settings. I usually keep it at 1, if that makes sense. All right, so now what you do need in this case, and something that we didn't do with the derma roller last week, was to apply a little bit of hyaluronic acid because you need something for it to slide on the skin. So it needs a little bit of slipperiness, just like if you've ever had an ultrasound done, if you've gone to the physio and they put the gel on, much like that, to slide the device around, you actually need something a little bit slippery. And you want to work just in little segments because that hyaluronic acid is going to dry very quickly. So I got to get going here. So I'm just turning on my device and you just hold it down and then you're just passing. And it just feels, what does it feel like? How do I describe? You can definitely feel something, but it's not scary. It just feels like tiny, 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 maybe little pricks, but not in a scary way. Like I said, I do not like needles myself, and it's totally comfortable. And I just kind of do like an S shape type of pattern, go back in that area, and that is it. So there you have it. And then this, of course, is something that you are going to take off and discard. And I would proceed after I've done that little section. Then, you know, I would have cleansed my entire face. But then, and can you see, is it getting a little bit red a little bit? So it's not too aggressive. But at the same time, I would go into the next section. You're going to be very careful around the eye area, okay, because that skin is very delicate and you're not going to pass, you know, more than once. Sometimes I pass in the same area a couple times, but you're going to definitely make sure that you're going to work in those small sections because that hyaluronic acid is going to dry out. So I usually do, you know, around the eyes, then I'll do the cheeks, then the nose area, the chin, and then, you know, the lower cheek, and then around the eyes again. And then of course the forehead. And there you have it, super easy, once a month, okay? So you don't want to overdo it. Now my body is going to start to help to regenerate. If you want to put another serum, the hyaluronic acid is great. If you've got other serums, now your skin is kind of open, so you may want to put whatever special serums you may have on your skin at that point and then go to bed. In the morning, it should not be red anymore. And if you've seen other types of devices, if you actually go and have treatments done, and you've seen other devices, they're more aggressive and there's bleeding and things, there's usually not bleeding, you know, at the settings that I set mine at, but I mean, everybody's is different. So I hope you love that. I just purchased the machine online, and this is, yeah, it's something that's so easy and amazing to do. All right, so thank you for everybody tuning in today. And guess what time it is? Okay, it's quiz question number 3 time. Is everybody ready? Today we're playing for the thyroid support from our great friends at Vitatree Nutritionals, Whole Food Vitamins, of course, the sponsor of our show. We thank them for making the show possible to begin with. Is everybody ready? All right, here we go. It's quiz question number 3. True or false? Memory loss can be related to andropause, something that we talked about in today's show. If you're just tuning in right now, yes, this one. All right, we've got about 20 seconds left or less. True or false? Good job, everyone. Got your answers Yay! Everybody has their answer in. Awesome, awesome, awesome. Thank you for sharing today's live as well. I see, so many new people were here, which was amazing. So I appreciate that. All right, let's reveal the answer, of course. The answer is true. So awesome job. That is great. Now, if you're just tuning in right now, so we've talked about vitamin K2. If you've missed that, that was an important conversation that we talked about. We are also talking about thyroid health today, which was important. If you do have questions, and if there's something that I went through very quickly, please tune in tomorrow for the Q&A, which is going to be at 1 p.m. Eastern Standard Time. Start using that hashtag, Ask Dr. Janine, and check out my other content as well. We also did the microneedling today, and we talked, of course, about guys' hormones, and we talked about andropause and why it's so important, of course, to fix that leptin resistance. I might revisit with some quiz questions next week based on what we talked about today, because it's important. I want everybody to understand about the leptin signaling and our circadian biology, why that's so important to optimize and make sure that we are doing that. Thank you so much. It was so great to have you all here today. Make sure you do tune in tomorrow at 1 p.m. Eastern Standard Time. Have a great night, everyone, and stay safe, everyone in Florida, and we'll see you tomorrow. Bye.